to get it right. In this episode, let us understand how public health comes full circle for controlling a pandemic. We will be comparing the similarities between the control of Spanish flu with COVID-19 pandemic. Philadelphia detected its first case of a deadly, fast-spreading strain of influenza on September 17, 1918. The next day, in an attempt to halt the virus's spread, city officials launched a campaign against coughing, spitting, and sneezing in public. Yet, 10 days later, the city hosted a parade that 200,000 people attended. Flu cases continued to mount until after 2 weeks. Schools, churches, theaters, and public gathering spaces were shut down. And just 2 weeks after the first reported case, there were 20,000 more cases. The 1918 flu, also known as the Spanish flu, lasted until 1920. It is still considered the deadliest pandemic in modern history. Today, as the world has been halted in response to the coronavirus, the 1918 outbreak offers clues and lessons for battling today's crisis. As we know, COVID-19 and influenza viruses have a similar disease presentation, as both cause respiratory diseases, which presents a wide range of illness from asymptomatic to severe disease and death. Additionally, both viruses are transmitted by contact, droplets, and fomites. During the influenza pandemic of 1918-19, public health departments in the Europe and United States were challenged as they were unprepared for an event of this magnitude, as many of their formerly known measures were ineffective. Thus, they used the fundamental measures to control epidemics that dated back to medieval times of the bubonic plague, by aiming to reduce the transmission of the pathogen by preventing contact. If we compare, then 4 major strategies were used: controlling community infections, that is shutting down schools, churches, theaters, and public gathering spaces. For controlling spread of COVID-19, in addition to the above measures, international travel, national lockdowns have been implemented globally. Guidelines for hand hygiene, safe distancing, covering their coughs, putting tissues straight into a bin, avoiding touching their eyes, nose, and mouth, cleaning regularly used objects and surfaces, and ventilating their homes and workspaces. Organization of medical and nursing services for early diagnosis and preventive treatment of disease. Clinicians considering testing of possible COVID-19 cases should continue to work with their local and state health departments to coordinate testing through public health laboratories or use COVID-19 diagnostic testing. Health workers and public health professionals are advised to conduct sensitization sessions with community influencers and leaders on prevention and control of COVID-19. As quoted by William Wordsworth, life is divided into 3 terms: that which was, which is, and which will be. Let us learn from the past to profit by the present, and from the present to live better in the future. That's it for this episode, guys. Hope you enjoyed it. Do share a word about our channel. Like, share, and subscribe. See you in our next episode.